In the first year when I was at Murphy Medical and I was in the emergency room, a patient of mine who I had known for some time came in very, very sick. He had been to a clinic that day and was claiming weak spells, and evaluation there didn't show very much. But then he passed out, was brought into the ER unconscious, was in shock, blood pressure not obtainable, heart rate was like 20 beats a minute on the EKG. He was basically dying. He was a man in his 40s. So we started the usual routine, put an IV in him, give him oxygen, put him on a heart monitor, give him drugs to restore his heartbeat, to improve his blood pressure, but nothing worked. In those situations, oftentimes the only treatment that can bring the heart rate up, which would bring the blood pressure up and save the patient, would be a temporary pacemaker. I had seen a few procedures, but had never done any. The patient's heart rate slowed down to where his heart wasn't beating at all. The EKG showed that he had had a heart attack, and at that point, at that time, with that patient, I knew I had to put in a temporary pacemaker to save him. I was trying to put in a pacemaker through the patient's heart, directly through the chest, because I had seen it done. I basically was doing it, not having ever done it before, knowing that that was the only thing that could be tried. So I put the needle through the chest into the heart and slipped the wire through and hooked the heart. And we did CPR at a time and as needed. The wire hooked in a safe spot, and we turned on the pacemaker system, and the patient's heart rate increased. It's up to 40, 50, 60, 80 a minute. And the patient's blood pressure recovered. He woke up. Basically, we saved the patient. It was like, I shouldn't have done that, but I had no choice. I shouldn't have done that successfully, but it did happen. And I was there. It was my time, my moment. It was like God had put me there at that time, at that place, at that moment, to do that. All of my skills, all of my training, all of what my parents had done, my teachers had done, made it possible. And it was, I guess, one of those spiritual moments that you find occasionally in your life that transforms you, that tells you this is what you were meant to do. When I was a kid, I did have some health troubles of my own, about a polio, and subsequently had some pneumonia and in the hospital several times. And so I got experience in hospitals as a patient, and I felt like if I could qualify, if I could make it through my education and become a doctor, that was what I wanted to do. I grew up in Boston with a family of 3 siblings. We grew up in the 60s. My dad was a chemist. He entered the military and spent 5 years in World War II. After the war, met and married my mother. My mother was stay-at-home. I was able to go to a Catholic high school run by nuns. I got a job for summertime to work as an orderly. When nurse assistants needed help with the care of men in the hospital, they relied on orderlies to care for men. Sometimes the work was difficult to do, in the personal needs of men who were sick in the hospital, but I enjoyed it. That was my first job, and it helped me to understand some of the more uncomfortable jobs that you have to do in medicine. I went to a small college in Maine called Bowdoin. My sister stayed as a special ed teacher, but my brother Kevin, he left Boston to become a casino dealer in Las Vegas. My brother Chris left Boston to be a Christian broadcaster in Jerusalem. It wasn't easy, but I did have the determination to get to medical school. When I went to medical school, which was in University of Pittsburgh, I had doubts that I would not be able to make it, that I wouldn't be successful, that would be too difficult for me. And once you get into medical school, they make it really hard for you to drop out. You are encouraged and supported along the way by your professors. With each year at school, I just seemed to be more excited and interested in what I was learning. Along the way, I realized that I did not have the manual skills and dexterity to be a surgeon. I learned that early on in medical school, that I should stay away from the operating room. I knew that my skills were more of a cognitive nature, that I would enjoy solving medical problems to make the diagnosis. So there are a lot of fields in medicine you can pursue, and I found the one that best suited me. And I remember making the decision, third year medical school, that I'd best be pursuing internal medicine, which is what I did. There was an elective opportunity for fourth year students to travel to a clinic in Jamaica to serve a poor community. And there I met a woman named Eva Neal. She was a nurse midwife. I followed her along, making home visits, seeing women in labor, seeing pregnant women, but also manning a clinic that did primary care for a total of about 3 months. And she was my earliest, strongest role model for me, and it was that my experience with her that I decided to become a primary care doctor in a rural community. So after University of Pittsburgh, I went back to Boston, to my hometown, and I was able to have 3 years there in residency at City Hospital. Many residencies in medicine were guided by the attending physician in charge of the patients, and along the way teaching medical students that traveled through the hospital with him or her. At Boston City Hospital, it was somewhat of the reverse. Interns in their first year of being a physician were in charge of the patient. It was the interns that did the history, the physical, the examination, the assessment, and wrote all the orders. While you were doing that, you were observed by the attending, but you did the work. You made the decisions, you treated the patients. You were the one who was responsible. It was a hard experience because you were continually met with responsibilities and needed to be right. You needed to do the right thing, and it was pretty tense and difficult at times. And I felt like after that experience that I could do just about anything. So when I came to Murphy, I felt like, even though I was many times on my own, I felt like it was possible for most of the cases that I saw that I could handle them. Boston City Hospital did not have a referral oncology or cancer treatment area, so the interns were given a month of rotation of caring for oncology patients at University Hospital. And I was providing care to a patient that Nancy was also caring for. One day when I was back at City Hospital, a fellow intern told me that he was interested in taking Nancy out, and she said no thank you, but she asked him about this other intern called Brian Mitchell. So he returned to tell me that, hey, you know, this Nancy Troxler over at University Hospital was mentioning you. So I did ask her out. It was not that easy. Nancy was quite a popular nurse at the hospital, and I had to ask her out 3 times before she said yes. We enjoyed travels together, both in New England and in the South. Nancy was from Greensboro. Her family lived there. Her father was an orthopedic surgeon there. And so I visited them, and we had some good time together. And while we were in Greensboro, we often traveled to the mountains in western North Carolina and on vacation time, and we're here in the Smokies. As reluctant as she was to first date with me, she was also pretty reluctant to get married. We were at Fenway Park watching a Boston Red Sox baseball game. I had already committed to moving to North Carolina to start the practice here, and I knew we were both leaving Boston. I said, now is a good time for us to get married, and let's do it. That was my proposal, but I did not get a response at that time, but I think it came in a more subtle fashion several weeks later when she started talking about plans for the wedding. And so she had accepted the proposal on her own, in her own time, and then I found out that I guess I'd better start planning on the wedding too. When we were deciding where to live after we got married, it was in western North Carolina that we decided to come. We got married on a beach house in Cape Cod, in a little town called Chatham. My wedding statement to her was, grow old along with me, the best is yet to be, the last of life for which the first was made. And her proposal to me was, you are my lover and you are my friend. The following morning when I woke up, I was wanting to do it all over again. About a week later is when we got our U-Haul van and moved to Hayesville. I was fortunate enough at that time to find out about a federal program called the National Health Service Corps. It placed physicians in needy areas in rural America to practice for 2 years, providing me a salary. The federal government gave us a weekend to travel to visit 3 different sites, and we looked at a site in Tennessee and one in Kentucky and then one in Hayesville. When we were flying home that weekend, we decided to write down which of the sites we liked on a piece of paper and show each other, and both of us wrote down Hayesville. We had a lovely experience that weekend in Hayesville. We had a tour by a man named Tom Day, who was a banker and a real supporter of the community in Clay County, and he's very kind to us and very convincing to us to practice here. The Good Shepherd nurses in Hayesville served us a meal one Sunday afternoon and sent us back to Boston with a gift of some chocolate chip cookies, which basically sealed the deal for us. And we thought that this was more than just 2 years of commitment to serve rural America. It was a possible career choice for us, and that's how it turned out to be. When I started here in 1976, medical care was at a minimum. There weren't enough providers, there weren't enough support staff, there weren't enough nurses. The facilities were marginal. Patients had to care for themselves. In Murphy, there was a small hospital run by the nurses. It had 20 beds, no intensive care unit. There was essentially no cardiac services whatsoever. EKGs were taken by a patient and sent to the University of Georgia in Athens, and the results came back like 5 days later. The ambulance in Clay County was run by the funeral home. There would be just the driver and nobody in the back with the patient. The county could not afford to train EMS. There was no helicopter service to transport patients from our hospital to medical care at medical centers, and often a 2 or 3 hour ride in an ambulance from our hospital to another hospital was necessary. So when you had a sick patient, you had to always judge if you should take care of the patient in the hospital, even if they were acutely ill, knowing that they may not survive a transport of 2 hours. My first couple of years, I worked in Hayesville in a clinic. I had to go to the bank to borrow money to start up a practice. I had to borrow money from my father-in-law. I had to hire a staff, manage the staff. I had an excellent office manager, Linda Seabolt, who stayed with me until I retired last year. An amazing woman who knew how to run a practice, and I did not know how to run a practice, but she carried me through. I frankly prefer the traditional practice where physicians run their own practice. And even though they don't have the convenience of a salary or someone to run the practice for them, they have the ability to do what they want to do with the practice, to charge what they want to charge, to give free care to those that need the care. And frankly, I think some of the decisions that are made in medicine today by the owners of medical practices focus, in some cases, more for the business end of care and not for the patient. I valued my early days of independence so I could have made the decisions that I felt most comfortable with, and decisions that I could sleep with in terms of doing what the patient needed and not what the business needed. I think there was a high quality of care possible, and I'm very glad I was a doctor during those years. I became noted to be one of the doctors in the Hayesville community at that time to do house calls. So shortly after I started, I was in great demand. And I found that the more house calls I made, there were fewer patients I could see in the clinic. When I got here, I was the only one who did cardiology work. I was the only one who knew how to read an EKG. You were on call 24/7, 365 days. My first year, I was totally absorbed in care. I was on call all the time. I had a beeper, and it usually worked. Sometimes it would run out of power, and I would, in the middle of the night, be awoken by a knock on the door, and was somebody from the police department who said, "Dr. Mitchell, your phone is off or your beeper's off. You better call the hospital," because that's how I would be reached. And so I returned to Boston to complete my third year of internal medicine residency, and I did, and I got my boards in medicine. I had told the folks in Hayesville, I'm coming back after my year in Boston to complete my training. I did. However, I didn't come back to Hayesville because Murphy Medical Center was under construction. I thought Murphy's needs were going to be great when the new hospital opens. So when I returned after my final year of residency, which was summer of '79, I moved to Brasstown and I moved my practice to Murphy. I was surprised, by the way, that folks in Clay County thought I was leaving to go far away to Cherokee County, that I had left them to go to some other community. When the new hospital in Murphy was created in 1979, I insisted on there being an intensive care unit, and the hospital board at that time resisted the development of a ICU. It took a while for me to convince the hospital authority to create a hospital ICU, and actually we remodeled the hospital at my request to transfer a couple of private rooms into an ICU. Even so, when we had that ICU, it was quite difficult. In those early days, we had limited lab and limited cardiac support. We had no ultrasound, we had no CT scan, we had no MRI, and we were often in communication with cardiologists and pulmonary specialists in Asheville and Emory to get us through the care of patients. Back then, it was much like third world medicine in a way. They were challenging times where sometimes the best you could do was not enough. You knew your talents could save their lives, and that you were meant to be there, that God put you there for those moments where you succeeded, and that you understood that when you didn't succeed as you wished you could, when patients were so sick they wouldn't survive, you did your best. There was a Frenchman named Lariche who said that physicians carry with themselves a small cemetery where from time to time they go to pray. It's a place of sadness and regret where they try to understand where they were unable to do what they hoped to do. I don't usually talk about the old times, which were pretty tough. We worked hard and took care of a lot of sick patients. In my first year of practice, we had that 2-bed ICU, and we had a nurse devoted to the care of patients in the ICU, and we were very busy. At that time, there were not enough nurses in the area to recruit and serve the needs of the hospital. And one day, the hospital board decided they would close the ICU, which was a real shock to me because we were doing very well and we were helping patients get through the most difficult health problems you could imagine. Sending them away on in a helicopter was not possible because there were no helicopter services. So they'd be on the road for 2 hours, acutely ill, and that was not acceptable. So I was told the hospital ICU had to close, and I got stubborn, and I decided it would not close. And I put out a notice to the hospital CEO and the nursing staff that I was going to take care of the patients on my own. And I did. I put in the intravenous lines. I drew the blood test. I sent the bloods down to the lab. I did my own EKGs. I gave oxygen treatment. And I did that for a couple days straight. And I succeeded in helping a few patients. They did not know the limited care they were getting, but I knew the doctor was there quite a lot of time. I had to close my practice to be taking care of patients. And a couple of wonderful nurses took time off from their nursing duties at the hospital to join me without pay to take care of the patients. And that lasted for about 3 or 4 days. And The staff knew what was happening, the board knew what was happening, the CEO knew what was happening, and they changed their mind and they opened it up again. And if I didn't do that, I might not have stayed in the community, because I couldn't have stood for patients to receive less than the best of care. In my first year here, when the hospital was open and I was working so completely and intensively, it was a stress on Nancy. Fortunately, she had come from a medical family and knew the requirements of medical care. And so she knew what it was like to live in a family where the physician, the father, would be absent a lot. She didn't like it, but she knew about it. And she made sure that I knew she didn't like it. And early on in our marriage, that first year was pretty stressful. I wanted to have children, and she did not want to have children at that time because of her experience growing up herself. And she made it very clear to me that I needed partners to allow me to have time for family. So it wasn't long after we started in that first year that I started recruiting. And fortunately, I was able to recruit Judy Littlejohn, and a year later, Keith Wren. So in a couple of years, we had a practice of 3, which meant that every third night I was on call, every third weekend I was on call, and life was easier. And that's when our children came. Kate came along 3 years after we got here, and Anna a few years later. So we were able to recruit along the way some good surgeons and OB/GYN, a fine pediatrician, and really get the hospital going. So I would say in the first 10 years of my career here, where the needs were really great, we just focused a lot on providing good care for our patients and also helping the hospital to grow. Because Murphy Medical Center started off in 1979 with I think there were 3 general practitioners, 1 surgeon, 1 OB/GYN. There weren't many of us, and it required a lot of recruiting effort to get our staff up to be able to do what a good community hospital should do. And we were all very pleased we could give the community a first-rate hospital in a small town. I feel the best part of my career was the early days when the need was the greatest. The ICU needed expansion from the initial 2-bed ICU that we had for several years, and I was able to convince Mike Stevenson, our CEO, and the hospital board to expand our ICU, and we established a cardiac rehabilitation unit. We also developed a memory care unit. I campaigned for many years to expand Medicaid. I wish it had happened a lot sooner than it did. Many improvements that were important through the years I was very proud to be a part of. I turned my attention to some community needs, particularly the schools. We had our growing family. I had 2 girls that were approaching school age. We had heard stories from other professionals, other neighbors about this and that school, this or that experience not being the one they wanted for their kids. And so we had some moments of indecision about whether we would stay here in the community and raise our family here or not. And our decision, fortunately, was that we would stay. Nancy joined the PTA and supported the schools in that way, and I ran for school board and was successful in getting voted in. And I had 3 terms in over 18 years. There were challenges on the school board. Facilities needed help that required property taxes. We saw the need early on for some consolidation of our schools. Unfortunately, back then, the effort to consolidate the 3 high schools in Cherokee County did not succeed. We were able to create middle schools, which we thought were very important. The summer pool in Murphy that had served the community for many years was in disrepair, and finally it closed, and a volunteer effort started thereafter to replace that pool. There was a meeting at the hospital, and I joined in that meeting, all wanting the new pool. Started out with a lot of energy and enthusiasm. Early on, we realized it needed to be more than just the summer pool, but there needed to be a multi-purpose year-round facility for the community. Something they'd never had before, but something we felt was important. We all started off gung-ho, but after several weeks, in fact, several months, nothing much happened. And the meetings became less well attended. And finally, it came down to a handful of people. Myself, David Hilton, who was on the town board, and David Lyden. And the 3 of us continued the effort. And I marvel at how we did, but we did it. It took us several years, and we raised $2.7 million. And in 2007, we opened a multi-purpose year-round pool and wellness center. We've had some successes, and that's one of them. COVID was an experience that was a real challenge. It was a terrifying epidemic. The first COVID case was a patient of mine who went to the casino. A few days after that, became ill, very ill. Was admitted to the hospital, placed in the ICU, and died. Shortly thereafter, a traveler from New York came to dance at the folk school, and after she had been at the dance, she became symptomatic for COVID and was tested positive, was quarantined, as was her family. But unfortunately, because of her dance experience, several other people in the dance and the community became ill. And at that time, there were so few COVID tests that literally you had to call the Department of Health in Raleigh and individually request a test to be sent to your clinic. And you'd get the test in 2 or 3 days. You'd test the patient, you'd send the test back to the state, and it was a week before you found out the patient was actually infected. I was then a new member of the Dogwood Health Trust. I was fortunate to be appointed to the Program and Grants Committee, and I knew about the folk school experience and the threat of COVID spreading through the Brasstown community, and I called Dogwood and I told them about it, and they said, "Well, how many tests do you need?" I said, "We need several hundred at least." We got 500 tests within like 24 hours. The early days were terrifying, and we had limited services. We had no treatments, we had no antibody. We had many, many patients sick and dying. We had the hospital entirely full. We had the ICU full. We had our respirators completely used. The referral hospitals were full, so we could not refer patients. Many of the patients in the hospital were very sick. Several would be dying. Then the second year of COVID, we got the vaccines, which was an incredible scientific advancement. And the vaccine was effective and had few complications. Man, it was really life-saving. And we were all real thrilled that a vaccine was available.
No more mandates! No more mandates! Freedom over fear! Freedom over fear!
But the response from the community, unfortunately, we had so many people who did not trust the vaccine, who did not believe that it was effective or thought it was too risky, that it happened too quickly. And there was a lot of stubbornness in accepting it. When the Delta virus came, there was a surge in the COVID that hit our community so hard. There was a large church service in July, and a few weeks after that, many members of the church became sick. It overwhelmed us, totally overwhelmed us. The ICU was full, the ER was full, ambulances outside the ER were taking care of patients in the ambulance. It was really overwhelming. And we lost 60 patients. 60 patients died in 1 month, and it was one after the next. We had to see patients outside the clinic, rain or shine, cold or warm weather. We would gown and glove, and I can remember patients of mine who came and were sick and had not been vaccinated and had low oxygen levels, saying you've got to go to the hospital, and within a week or two they were dead. It was avoidable and so heartbreaking. Around that time there was good news though. The antibody treatment started, and we set up a 7-day clinic, 10 hours a day, to give the antibody treatments to patients. These were patients who were sick, positive with COVID, not having gotten a vaccine, and at that time they were very willing. Despite the fact that you will have these wonderful moments where you feel like, boy, I had a great day today, I helped make a diagnosis, I helped guide somebody correctly to a specialist, or I think I got it right. There are days where you say, I wish I had done that differently. I really feel I could have been better there, and feel that you did not measure up. You carry those memories and you wish you could have done it better. Unfortunately, Murphy Medical Center could not sustain its services for many reasons, economic mostly, where the cost of health care was rising, reimbursements for rural health practices were falling, competition from other nearby healthcare agencies was existing. It was a challenge to see the ownership of the hospital transferred from Murphy Hospital Authority to a health system like Erlanger. Erlanger fortunately wanted to partner with Murphy and brought their large enterprise to bear to continue providing primary care here, which is what was necessary, and we're grateful for that. Unfortunately, they were not able to expand services, and some of the services actually were reduced by Erlanger, which is unfortunate. But overall, it provided us continued medical care. It's kept many of the doctors in practice now that otherwise probably could not be. It is what is happening in rural health care throughout the country. In the first few years, Nancy and I were living in Hayesville before we moved to Brasstown. We had heard about the folk school, maybe gone to a few concerts, but we heard about it enough to be curious, and we showed up at a few of the dance practices.
Ladies and gentlemen, sticks in the mud!
been fortunate to be a member of the Morris dance team. During my years of medical practice, during the hard weeks, you worked hard during the day and were exhausted, but every Wednesday night, midweek, I could go to a Morris dance practice, to live music, to fellow dancers, to sing, to clap sticks, to march around and dance to the beat of the music. It was just a wonderful, transforming experience, rejuvenating really. And frankly, that's one of the reasons why we may have stayed here. We felt like this is really a special place. There's no, like none other. And we would be foolish to give up such joyful times. I'm now retired almost a year. I'm in my mid-70s. Though I miss my patients, I'm able to enjoy more friendships, having more time with family. I'm able to spend more time with the folk school. I'm real satisfied with the Pool and Wellness Center. I wish the best for my hospital. Right now I enjoy sitting on the porch, listening to the birds, hearing them sing, having a walk every day with Nancy. It's a beautiful place to live. I'm thankful for each day. I have a cancer that is being treated. It's been with me since 2019, and I've gotten good care and good treatment. You know, I've been through surgery, radiation, chemotherapy. I'm on chemotherapy now, and I'm hoping for the best. I make each day count. I'm grateful for my time. Glad that I've had 76 years. I've had the benefit of a happy and useful life. I was turned off by so many of my colleagues in training who were just so eager to get ahead, be competitive with others. It was part of academia that I detested. Wanted to get into the best cardiology fellowship or oncology fellowship, and somewhat of a overly competitive relationship I had with other interns and residents, and it just was so uncomfortable for me. Knowing what I had learned in medical school and my experience in Jamaica, where, man, you get to be a doctor, you learn primary care, there's so much you can do. There's so many needs. Don't worry about success. It's there for you to grab. And that's the way I felt about coming to Murphy. I remember in an ICU discussion I had with the ICU nurse director at Boston City Hospital. It was my last year then. I was about to come to Murphy, and I told her about it. And she said, "Is that for choice?" Yeah, it was. It was for choice. Yeah, she didn't understand. I said, man, she didn't understand. And I got what a lot of fortunate doctors got is a successful, full, challenging, rewarding practice in a beautiful area of this country with good friends, good people around me, good family. I've had it all, and I couldn't ask for anything more but a yes. It was for choice.